My name is Emily Houston. This is for Nursing 400 at Athens State, and this is my paradigm care analysis. This is my certificate of original authorship. I certify that I am the sole author of this assignment. Any information in this assignment that is not my own is clearly documented. I use quotation marks appropriately. I cited any and all sources from which I used, images, ideas, or words, either quoted directly or paraphrased using the APA 7th edition standards. I also certify that the information in this paper was prepared by me specifically for the purpose of this assignment, and I have not submitted any parts of this assignment for previous assignments. I understand that plagiarism policy of Athens State and nothing in this assignment violates intellectual property laws. My type name below is intended to be the same as my signature on this document, Emily Houston. Paradigm case experience. So this experience occurred back in October of 2014. I was in senior health care at my high school, and during this experience, it was our day to go to clinical. My instructor / teacher gave my clinical partner and I a report of a patient, and we wrote down the report, and then we went to go gather our supplies for assessing the patient, such as like vital signs and listening to his heart and lungs and bathing the patient. So we grabbed all our supplies. My clinical partner and I walked into the room and introduced ourselves and explained to the patient that who we were and what we were there for, and that we were going to help give him a bed bath since he was a total care patient. Well, the patient stated he didn't want a bed bath, and we were trying to encourage him and say that we're here to help him, we're glad to help take care of him to our best ability. And he was like, well, you don't understand. And he flipped back the cover and he was missing a leg. And in our report, we were not told about him missing a limb, and I think he felt a little ashamed and embarrassed by it. But we encouraged him. We said it was okay and that we could leave the supplies there if he would like to just wash up his face a little bit. And he was very thankful and appreciative of us and thanked us so much, but he preferred to bathe himself. Paradigm, a case ethical consideration in learning. On this slide, we'll discuss autonomy, which is the ability of a nurse to understand a patient's right to their medical care and let them independently make decisions without consulting a healthcare provider. In this, in my case study, my patient, he, refused bathing assistance. So as a nurse student at the time, I let him, because he has the right to refusal, and I didn't have to consult a provider for that. Any patient can refuse to be bathed if they don't want to be bathed at that current time. My obligation to perform required professional activities at a level commensurable with one's education in compliance with applicable laws and standards per the ANA 20151, page 45. And referring to the ICN Code of Ethics for Nurses, I think professionally ethical standards were achieved because I did not make the patient have a bed bath because they refused, and I let them decide for themselves because it's not my place to make a patient take a bath if they do not choose to do so. And I learned that it's good to listen to the patient and their rhyme or reason of why they do not want certain things in that current moment, because he said he would do it later because it was early in the morning and he was embarrassed of not having all his intact limbs. And I made the patient feel better about themselves, and I tried to boost their confidence and just talk to him. Me and my clinical partner just talked to him instead, and that was the end of the outcome. Paradigm case: treatment and critical thinking. Treatment of patients with type 2 diabetes. This is what my patient had. So type 2 diabetes is mainly the result of two problems. One, the cells in the muscle, fat, and the liver become resistant to insulin. As a result, the cells don't take enough sugar. The pancreas can't make enough insulin to keep blood sugar levels within a healthy range. So, to help treat this, we use anti-diabetic medications such as metformin. It's very common, it's well tolerated, and well-studied medication that reduces the amount of glucose the body produces and improves insulin sensitivity. Metformin is often the first medication prescribed for type 2 diabetes and is used in combination with diet to lower blood sugar levels. One side effect, though, about metformin is it can cause diarrhea. Another form of treatment, if oral medication didn't work, would be Ozempic and pramlintide, which these are injectable drugs that are used with insulin to lower the blood sugar levels. Some psychosocial aspects of patients that have type 2 diabetes could be depression, anxiety, and adjustment issues due to being diagnosed with, because they have to make a lifestyle change such as diet, exercise, if they're smokers, quit smoking, and it's a lot to take in and process. Another process of critical thinking steps in the problem identification and solutions to the problem would be, how would we know if a patient has type 2 diabetes? Well, we would check their lab, which the lab is called an A1C, and it's basically the median number of what a blood sugar has been, the patient's average blood sugar has been running the past 3 months. And usually we want it to be, at my clinic, 6% and below. And if it's 6%, the patient's usually pre-diabetic. And if it's 6.5 and above, they have type 2 diabetes. And how we can manage this, like I said earlier, would be weight loss, diet, exercise, medication, smoking cessation. Some healthcare issues related to type 2 diabetes would definitely be medication costs. If a patient is diagnosed with type 2 diabetes and they don't have Medicare, Medicaid, or any other forms of healthcare coverage, it can be very costly to get their medications needed to help treat them. The pharmaceutical companies charges a lot of money for medications, even though the medications help treat the patient and can keep them alive. The patient can also, they need to check if they're on insulin, they need to check it twice a day to determine how much insulin they need to give themselves. And if they take metformin, then they need to check their blood sugar every day or every other day, just to make sure their blood sugar is being well maintained. I've had many patients that have actually had diabetes as being a nurse, and some things we educate patients about are like checking their feet daily to make sure they don't develop sores, because a lot of patients that have type 2 diabetes develop diabetic neuropathy, and they can't feel, like say if they stepped on something, which can cause a sore and cause it to be infected and other issues to arise. We want to keep their feet nice and dry, because putting lotion between their toes can be a risk for infection. Here are my references I used on this case analysis, and I hope you enjoyed my presentation. Thank you so much.